Hi, my name is Abrea Bennett, and I'm a student nurse at the University of South Alabama. Today I will perform the urinary catheter insertion skill, indwelling catheter insertion skill. I'd first like to acknowledge that I have performed hand hygiene, and I'll be performing skills 5 through 22, omitting number 21, and on skill 17, I will only be withdrawn from the port. I'll first begin by opening my kit. I will use the bag as a trash bag positioned by my patient's hip. Now I will open the bag first furthest away from me, touching only the 1-inch border. Now the side closest to me. Now I will don my sterile gloves. The next thing I'll do is I'll begin to open my drape, placing it between my patient's legs. Make sure that there is no space. Now I will remove the tray, making it closer to my patient, and I would like to verbalize that I will then place the betadine over the cotton balls. After I have done this, I will then remove the plastic wrap from the catheter. I will dispose of it in my trash bag. And now what I will do is I will attach my water-filled syringe to the balloon port. I'm verbalizing lubricating 1 to 2 inches for the female and 5 to 7 for the male. Now moving my box closer. The next thing that I'll do is I'll begin performing a principle of asepsis. With my non-dominant hand, I will hold down. I will be cleaning the urethra of the female urethral opening. First cleaning the first side, disposing. Now the second side, disposing. Make sure not to move my hands. And now I will clean down the midline from the clitoris to the anus. And I would like to note for the male, I will clean the urinary meatus going outward. Now what I will do is I will begin to insert the catheter. I will explain the procedure to the patient, and I will ask my patient to bear down as if voiding. I will also ask my patient to take a deep breath and to exhale during the insertion. Okay, I will insert for the female until urine is returned, and then advancing 1 to 2 inches, and for the male all the way for verification. I would like to acknowledge that the male penis is perpendicular to the body, and and it is held slightly with traction. Okay. The next thing that I will do is I will hold the catheter with my non-dominant hand, which is contaminated, and I begin to fill the balloon. Keeping pressure on the plunger. Now what I will do is I will detach and I will set this aside. The next thing that I will begin to do is I will gently tug, now slightly advance. After I have done this, the next thing that I will demonstrate is the use of my stat lock. I will use my skin protectant prep pad to clean my patient's thigh, and I will dispose. I will allow time for it to dry, and I will note that I'm attaching the stat lock to avoid any trauma to my patient's urethra at any time. I would do this by removing the adhesive, attaching it to my patient's thigh. After it is attached to my patient's thigh, I will then attach my stat lock. And I'm demonstrating how I would unlock my stat lock like this. Okay? After this, the next thing that I will do is I will demonstrate how my drainage bag will be positioned. It will be positioned on my patient's bed frame, never on the bed rail or the side rail, and it will be below the patient's bladder level. Okay? Now what I will demonstrate is how to collect the urine from the port. I will first kink the tubing, now securing it. I will grab my lure lock, which I do not have, and I will attach it to the port. But before I attach it to the port, I will use my alcohol prep pad, and I will clean this port. Now disposing, twisting it onto the port, and I will withdraw the urine. Okay? After I have done this, I will keep it held upwards, and I will grab my specimen container, making sure that it is held upwards at all times. And I will now begin to make sure that the syringe does not touch the inside of the container at all. Now I will begin to let the urine flow out into my urine specimen collection container. Now what I will do is I will then recap it, and I will send it off to the lab after it has been labeled. I will also set this aside again for later use. The next thing that I will do is I will make sure that this has been unkinked. I will dispose of all of my equipment. Now disposing of my sterile gloves. Glove to glove, skin to skin. I perform hand hygiene, making sure that my patient's bed is lowered, side rails are raised, my patient has their call light, and all of their necessities will be within a comfortable reach. Next thing that I'm going to do is I'm going to demonstrate the discontinuing of my indwelling catheter. I'm going to verbalize that I have on my goggles, and I am putting on my clean gloves. I'm going to verbalize how I will collect urine from the drainage bed. Because you see my towel, I will make sure that a towel will be down on the floor, and I will use my graduated cylinder. I will make sure that I uncap this, and I will have it on the inside collecting the urine, and I will make sure that I bring the tubing into the graduated cylinder and the specimen collection cup. I will make sure that I unclamp, let it run through, and do not touch the inside of the collection container. And after it has ran through, the next thing I will do is I will reclamp it, pushing it back to its position, and it will be able to be measured with the graduated cylinder or the specimen collection cup because they have numbers on the side. Now what I will do is I will begin to grab my 10 milliliter syringe, and I will loosen it. After I have loosened it, I will then place it on 0.5 milliliters. And I'll collect it, I will connect it to my balloon port, and I will allow it to empty with gravity. Okay? After it has emptied with gravity, what I will then do now is I will set this to the side, and I will then begin to remove my catheter by kinking, and I will do this removing it gently from my patient. Okay, and I am only having troubles because there is a problem with my catheter. The next thing I'll make sure that I do is I'll perform perineal care, and I will document for the color, the amount, the consistency of the urine, the odor. I will also document for the intactness of the catheter tip. I will document the water flow from the syringe. I will document my patient's tolerance. I will also document the UTI symptoms, which can be bladderness, the bladder spasms, fever, any I can document to see if there's any urge to urinate, and I will also document to see if my patient may have elevated white blood cell count. And I will also make sure that, to go over my documentation one more time, I'll make sure that I document the color, the amount, the consistency of urine, the odor. I'll make sure that I document the flow of the water from the water-filled syringe. I will also document the intactness of the catheter tip, my patient's tolerance, and like I said, the UTI symptoms. I want to make sure that I have said everything. Now I'm going to plan and assess for any voiding for 4 to 6 hours. If there's no voiding, what I'll do is I'll palpate my patient's bladder or obtain a bladder scan. Thank you, and this will conclude my skill.